The objectives of this presentation will be a stepwise guidance on how to develop high alert medicine list specific to your hospital. And this is in accordance with the letter issued by DRAP on 27 September 2022, instructing all public and private hospitals to develop hospital-specific lists for each entity. Number two, how to display the list prominently for staff's knowledge and information within your hospital. And number three, staff training and education on the high alert medicine list and the national guidelines on high alert medicines. This is Salwa Ehsan, Chief of Pharmacy, Shifa International Hospital, and Senior Vice President, Pakistan Society of Health System Pharmacists, and I will be discussing that how to develop high alert medication list specific to your hospital. Just to remind you that in the letter dated 27 September 2022, DRAP has instructed all the healthcare facilities, including public and private hospitals, to develop the institution-specific high alert medication list within 6 months, that is by March 2023. And once the list is developed, train your healthcare staff on that list so that everyone knows that what are the medications identified as high alert medications within your facility and what are the risks associated with them, and display the list prominently in the pharmacies, doctors' offices, and nursing stations. So in light of this instruction issued by DRAP, let us see that how we can prepare high alert medication lists specific to your own hospital. These guidelines are available on the DRAP website, so for details, please refer to the main document. So in order to make a list, let's see the steps involved. The first step includes you have to have a multidisciplinary team which must have representation from the doctors, nurses, and pharmacists side. If the hospital already has a functional pharmacy or drug and therapeutics committee or any equivalent committee, it can also serve the purpose. The step 2 includes that you have to first refer to the National High Alert Medication List, which you can also call Master List, that includes all the high alert medications available in Pakistan. This master list is available in the section 9 of the guidelines, or you can also find the list on the DRAP's website. The step 3 includes that while reviewing the master list, that is the National High Alert Medication List, identify the medicines that are available in your hospital. Then check which of these can be designated as high alert medication for your hospital. In order to designate any high alert medication as high alert for your facility, the decision should be based on certain criteria, such as what is the average usage of these medications in your facility? Are there any past incidents, medication errors, or problems reported with their use specific to your own healthcare facility? What is the baseline knowledge of your staff about the safety hazards of these medications? And finally, the mutual agreement of the committee comprising of the doctors, nurses, and pharmacists about the medications that you have shortlisted. It is important to note that in Pakistani scenario, there are certain high alert medications which are associated with significant number of errors and harms in our healthcare scenario. Therefore, if available within your formulary or inventory, you must consider them for addition in the hospital-specific high alert medication list. These medications include concentrated electrolytes for IV use, such as potassium chloride, magnesium sulfate, potassium phosphate, and hypertonic saline, all for intravenous use. Neuromuscular blocking agents, also referred to as paralyzing agents, look-alike and sound-alike medications, insulins, anticoagulants, and opioids. Step 4. Once you have decided that out of the master list, what medications must be identified as high alert medications for your facility, formally approve the list, and the committee designated to develop the list should approve the list. The approved list should be disseminated to all the healthcare staff, especially to the doctors, nurses, and pharmacists. There could be many ways of dissemination of this particular list. You can have color laminated printouts that can be pasted in prominent places within the pharmacies, doctors' offices, and nursing stations. Or you can have a soft copy of the list that is displayed on the hospital's internal web or intranet, and the site must be frequently accessed by the healthcare staff, so there should be a constant reminder. In addition, a copy must be retained in the hospital approved control document section. These are some of the sample lists that have been created by different hospitals within Pakistan, and you can see that they have creatively identified acronyms just to make sure the staff just to make sure that the staff easily remembers what are the high alert medications that are designated for their own healthcare facility. So now the list is developed, it is disseminated, and the staff is informed. So the next step 5 includes that you have to conduct proper training and awareness sessions, especially for the doctors, nurses, and pharmacists about these medications. And the training should include not only the existing staff, but should be imparted on an ongoing basis for any new joiner in the categories of as a doctor, nurse, or a pharmacist. So the goal of this training and awareness should be that the staff must know the list of high alert medications specific to their healthcare facility, plus they know the associated hazards of those medications. The next step, step 6, includes promoting the culture of reporting any issues, errors, mishaps, near misses with all the medications generally and specifically for the high alert medications. This reporting is really important because once the data is gathered, it can be analyzed for the process improvement. The multidisciplinary committee comprising of doctors, nurses, or pharmacists, such as Pharmacy and Therapeutics Committee or equivalent, is given mandate for the analysis and process improvement. Step 7. Step 7. Revise the high alert medicine list of your hospital at a regular interval, for example, at least every 2 years or sooner as applicable. And selection of drugs should be based on the similar criteria that has been previously described in step 3. So in summary, all hospitals, public and private, in Pakistan must develop their own high alert medicine list within 6 months. Display this list prominently within your healthcare facility, train the staff and spread awareness on the use of your selected high alert medications in a safe manner. Refer to the National High Alert Medication Guidelines for details and further training and development of SOPs and policies to safeguard patients from medication-related harm. Thank you. To access the guidelines, visit DRAP's website or follow Pakistan Society of Health System Pharmacists website or their official page on Facebook and LinkedIn. Know your role, play your part.